To be better Aussie men, we have to acknowledge that we need to be healthy. By no means am I suggesting we all need to be ninja warrior fit. What I mean is that we need to look after both our bodies and our minds. As blokes, we get preoccupied with our physical fitness at times and let our mental fitness suffer. Before I start, I think it's important to clarify that we can put illnesses into two categories: preventable illnesses and those that we're genetically predispositioned to. Nothing you could do would prevent genetically predispositioned illnesses from affecting you in some way. So my focus in this video is on the preventable illnesses. Today I want to talk more about our mental health. As I just said, some illnesses are preventable and some are ones we're predispositioned to having. Some mental illnesses aren't preventable and specialist medical advice and support is needed. There is mental ill health though that we can take steps to prevent or manage. Beyond Blue, an Aussie organisation that is trying to raise awareness and offer support to Australians with regards to their mental health, has done some amazing work in this area and surveyed Aussie men on how they prevent mental ill health and what they do to manage it. I think the results of that survey offer some great lessons for us all, and I want to go through two areas of action you can take for your own mental health: prevention and management. Prevention. Let's start with positive strategies that Aussie men use to prevent themselves feeling down. The top strategies from the survey dealt with attaining and maintaining good physical health. We can achieve this through eating healthy and exercising. We don't need to be trying to consume all the current superfoods or running a marathon every day. Making drastic changes, while it may work for a few, doesn't work for most of us. If we can recognise that our physical health isn't great, then we need to work on replacing damaging habits with new habits that are beneficial to our goal of gaining and maintaining good physical health. We also need to be kind to ourselves and acknowledge that our physical health will fluctuate and injuries or illnesses can have an impact on our current level of physical fitness. We can't beat ourselves up if we can't maintain our habits when we're physically limited from achieving them. The next strategy is to take action to prevent a low mood. This can be achieved through keeping busy, having a hobby, a social schedule, regular activities. Whether you're an introvert like me or an extrovert like some of my friends, there is something you can do to keep busy. For me, I like a good project, whether at work, at home, or in some of the organisations I volunteer. So we can also actively achieve something, whether big or small. The act of planning and executing a plan to attain something has great benefits for our general mood. The list of what you can plan is endless: a holiday, a renovation, becoming financially independent, leaving home for the first time, undertaking further education, an end-of-year club function, a charity fundraiser, or even a change in career. There are many more, and I'd love it if you'd share what you're planning in the comments below. The third strategy Aussie men use to prevent themselves feeling down is having a positive external connection. This can be achieved through doing something to help another person, whether that's volunteering your time, helping a neighbour or friend, or even helping a colleague at work. Also, hanging out with positive people or spending time with a pet helps us develop these positive external connections. The act of connecting allows us to get out of our own headspace, because when we get wrapped up in our own thoughts, we forget about the wider world around us and the people within it. Sometimes I'll be walking along and pass by someone and will ask myself the question, I wonder what their life is like. I wonder what they think about, their hopes, their dreams, their aspirations. This takes me out of my head and allows me to make a connection with someone for a very brief moment. It can be enough to shake me out of a rut. The final range of strategies involves actively engaging with our thoughts and our feelings. Aussie men do this best through using humour to reframe thoughts and feelings. We do well when we can laugh at our small misfortunes. But sometimes we can't laugh off our feelings, and you also need to be accepting of having sad feelings. Some things just suck, and we're going to feel sad. Being able to say to ourselves and our minds that a situation is making me feel sad or angry or frustrated helps us manage the feelings. This strategy is all about noticing our thoughts and then in most circumstances trying to change our perspective on the situation or event. The saddest I've ever been in my life was when my dad passed away. I still, more than 10 years later, feel moments of sadness when I think about him not being here. But then I reframe my thoughts to memories of the great times we had together. But I acknowledge that for others the reverse is true. The memories of an abusive father bring much sadness and can only be reframed with the peace of being free of that abuse and being able to build a better life. Whatever our thoughts and feelings may be, when we make a conscious effort to spend the time engaging with them, we can prevent ourselves from spiraling into further feelings of being down. These feelings of sadness that invariably come into our lives remind us that life is never perfect, and we're going to have times or days where we aren't happy or contented. When we have a change in mood, we need to acknowledge this and realize that we need to do something to manage this change in mood. So what are our strategies for management? When our mood changes, Aussie men use the following strategies, which link closely to the strategies of prevention. Alter eating or exercise habits. Looking at our exercise and eating habits to see if something needs to be altered. We may have had an injury which is preventing us from our usual exercise. This changes our mood. We need to replace our usual exercise with other activities to maintain our fitness. When it comes to eating, do you need to refrain from certain food or drink? Or alternatively, do you need to eat and drink differently with different moods? The second one is to engage with our thoughts and feelings. This can be through accepting our sad feelings as a natural consequence of the situation, or by reframing the situation through humour. You're going to be angry or frustrated when you lose your job through no fault of your own. You're allowed to feel this way, but you're not allowed to stay in these feelings. You can't let them consume you. So how do we do this? Let's look at the next strategy. Number 3 is to keep busy. While it's important to say, yes, I'm feeling down, sad, angry or frustrated, it's important that we don't let this stop us from the rest of our lives and the positive interactions and activities that make up our life. If you've lost your job, be angry or frustrated, then move into planning your next steps. You've now got a project to work on and things that need to be planned. Ultimately, we need to acknowledge the situation or problem and then take steps to solve the problem or mitigate its effect on our mood. Aside from coming up with a project or plan, you can also do the following to mitigate the effect on your mood. Taking time out, whether by yourself, with family or with friends. Rewarding yourself with something enjoyable. Distracting yourself from negative thoughts and or feelings. And talking to other people about the problem. I want to finish on that last point. If all these ideas don't help you maintain your mental health, then you need to seek professional assistance. Go to your doctor and tell them that you want to develop a mental health care plan. They'll talk with you about how you're feeling and what's been going on. They'll then work with you on a plan to help you improve your mental health. In some situations, this might even include a referral to a psychiatrist, a doctor who specialises in mental health, for a clearer diagnosis and support. The Australian Government, through Medicare, will pay for most, if not all, of the costs of these sessions, and it's up to a certain number each year. I've included a range of links below which have further information on mental health plans. Again, if things aren't working for you, please go and see your doctor. Please share this video with your mates so the message of improving mental health for men can spread far and wide. Look after yourself, and until next time, keep being a better Aussie man.